full description for us. I will probably not delve deep into that, but that's a great interaction point as well, whether it's directly or indirectly through the pharmacies, as well as through the distributors that go through the pharmaceutical companies. A patient's home is also a very, very important stakeholder there, because there are a lot of caregivers. And today, the caregivers are very, very equipped, well equipped literally, to understand what is happening to a patient and be able to hence, literally influence opinion as to how the medication that has to be given to a patient is to be, taken or given, or request the doctor as to what has to be done, and make sure that, access to medical information and knowledge, as well as the medication itself is, available very close to the patient's surroundings. And of course, research centers. The third, the other important point, which we probably is not very, visible today, is the intermediaries. The TPAs and intermediaries, as we call the third-party administrators. These are again an insurance terminology that you would hear. There are a lot of TPAs in the industry here right now in India as well. We hear of, and if anybody's had this experience of having their patients or their members being admitted to hospital and especially covered through insurance, it is very common that the hospital would ask, who is the TPA that is, administering this insurance for you? And it's typically the names like ICICI Lombard, who does a TPA for themselves, or UHG India, which is also another TPA themselves. These are some of the big players that you hear who have a large market coverage that, again, influence the kind of work and interactions that the whole stakeholders have in this ecosystem, and need to be enabled more from, not just from through, making sure that the transactions are completed, whether it's a claim or a membership or enrollment, but also from these days especially making sure that the reach that they have to the patients is actually utilized to, towards wellness management, towards disease management, and really be able to tap into their abilities of reaching the population, because they have the complete membership in their hands, and hence reduce the cost of care through preventive medicine. So overall, it's a very large ecosystem, like any other actually, but that's a good thing for us, because when we say that there are a lot of complications, a lot of problems, as Dr. Shripati Rao put it, in this whole industry, it is also a great opportunity for stakeholders like us to be present, to enable these interactions and ensure that we are able to deliver value to these stakeholders in their own ways, in how they want to interact, as well as make an impact into this industry itself. The market itself, I think probably I'll skip this, just for information. We know that it's a large market. Most governments worldwide, I think, are stressing heavily on education and healthcare, and that's no different in India as well. We have a large global market on IT, which is as well a $4.1 trillion worldwide expenditure on healthcare itself and on health IT. So you would have that translated back to India. If you see, it's a much smaller kind of proportions that you will see, where the healthcare market in India itself is at about 34 billion, but the IT market is less than 1% of that, maybe at about 254 million. Expected to grow strongly, but still, there is, as Dr. Rao put it at the beginning, I think there's a lot more emphasis in the country on care delivery and care management, rather than on enabling of systems towards implementation of those care delivery and care management activities. So the system implementations themselves will probably, hopefully at least, start taking some more impetus in the coming years, and make sure that those numbers will start looking upwards. I'm assuming that these numbers are very conservative, as we see, given that, given the kind of demographic requirements we have, and given the kind of interactions that each of these stakeholders need for us to be enabled. So as we see, the healthcare the whole healthcare paradigm is in a state of flux. I wouldn't know whether it is really a state of flux only now, or I think it's been in a state of flux for many years, but probably it's at an inflection point where we see multiple things happening in this industry. Most of the healthcare stakeholders are actually dissatisfied with the cost, rising costs. I'm sure the patients and the governments are pretty much unhappy with the rising costs. The providers are unhappy because they are being tied down to those costs, and hence being asked to perform with given outcomes, or with positive outcome-based reimbursements being done to them. There's also the quality that is being checked. There are the concepts of pay for performance that have come up in certain Western worlds, which are also, you know, implying that doctors and providers have to make sure that the quality of the outcome of any, you know, case that they handle is actually you know, in a way that makes sure that, you know, if it's a hospital admission, the number of readmissions come down. Otherwise, they would get they would be, you know, penalized for a readmission that might happen sooner than it is normal. So such kind of things are, you know, making sure that the whole industry gets dissatisfied one way or the other, because any which way you look at it, each of the stakeholders has a reason to be dissatisfied. You look at the medical costs, they continue to rise as we speak. In the US GDP, it's about 16% of the whole US GDP goes to healthcare, and expected to go to 19 to 20% by 2020. And I think that's a huge expense, or any budget or any country that it should be spending on healthcare. Though it's a good thing. I think the stats that Dr. Rao put was, you know, 1:300 doctors for the population that US has. That's a pretty impressive target, but it also has actually taken up the cost of care. Have they really leveraged each of the doctors to their full potential in actually making sure the care is delivered? Because maybe it is that there is an overuse of the hospital or the, you know, the medical systems that are there, and hence taking the costs up. There's an overconsumption as we speak. We know that a couple of years ago, you know, all of us were talking about recession, and maybe getting into a double-dip recession as we speak, and how the implications of that would be on most of the industries, and what would happen to healthcare. I think I would say that, you know, maybe we can you know, very safely say that healthcare is pretty much a lag indicator of any of these terms, whether it's recession or depression. We really don't figure that out right at the beginning. But when everybody was talking about recession and, you know, consumption going down, whether it's from a retail side or a housing side, healthcare costs actually went up. That was because I think there was the fear of losing insurance. There was a fear of losing all the, you know, benefits that they were given, and hence they started consuming some optional services that they could do before they would run out of insurance. So, you know, it might be one of the lead indicators to look at recession, but truly speaking, irrespective of whatever the, you know, situation in world economies are, healthcare has pretty much been recession-proof, and I think those are the kind of headlines that frequently make the paper, saying healthcare is recession-proof or Medicare is recession-proof. I wouldn't completely agree with it. I think there are the similar trends in revenue numbers or in terms of market sizes that you see going up and down, bobbing up and down with the recession numbers. But relatively speaking, with other industries, I think healthcare has kind of stood the test of time with respect to especially the need for care, as well as for the kind of consumption that you see in that area. Spoke about governments flexing their muscle. I think that happens everywhere. Governments are also waking up to the reality that, especially in certain Western worlds where it's quite a bit of a welfare economy that you see, US as well as Europe, that they are no more unable to bear the cost of healthcare for their whole populations. It is going to be impossible to tax their citizens more than 60–70% of their revenues or incomes just to feed healthcare. So obviously there's going to be a backlash on finding out how much more can the citizens pay as taxes just to you know, take care of citizens or people who are who need healthcare, especially given that they do not have a great demographic dividend. They have a lesser number of people actually you know, giving the incomes and the taxes, and more number of people feeding off of them because they have an aging population. So it's a you know, double-edged sword for those countries. They have no choice. India probably has got the, you know, better advantage of the demographic dividend in that sense, given that we have a much younger population compared to many of these Western economies. Same is the case with China, but China we don't know. We'll have to see how their population control is you know, shaping the whole pyramid or the diamond that they've created from a population or a demographic picture perspective. So given all the, you know, challenges with respect to how to fund healthcare from a government perspective, especially for the aged, the retired, the people who are underprivileged, the young and the needy, literally, who are not having incomes enough to support their families for healthcare. It has become the government's responsibility in each of the countries, but governments themselves are finding it very difficult to fund this. And naturally, they want to come up with reforms so that they can plug those holes they have in ensuring that their people can get covered through insurance. So if you see in US, I think the biggest topic that we've heard since Obama took over, as well as during the election debates, was on healthcare. And he came up with this new big PIPACA Act, which mandated insurance for every citizen of the country. Though it's being challenged in the Constitution and in Supreme Court, it is still a very path-breaking effort, literally, to make sure that there's coverage for everybody in the country and everybody pays for healthcare as well. Whether it's some minimal amount of a $700 premium or something, it still is a big step towards making sure that the risk pool is increased and everybody gets to pay for healthcare as well as get access to healthcare. So governments truly are flexing their muscles, literally making sure there's reform. They're also making sure there's some standardization that is followed in the kind of data interaction that happens between the different stakeholders, so that they are able to make sure that not too much time and money is spent on trying to read each other's data and each other's formats and making sense of them or helping the interactions get enabled better. But yeah, of course, everybody thinks that healthcare obviously is a great growth opportunity. There are very, I did not purposely put the names of the big healthcare companies that are there, because obviously they would think that that's the best industry to be in. But then everybody else is also becoming competition to the healthcare companies. Why is Microsoft trying to do something in healthcare? Or why is Samsung? I thought Samsung everybody was talking of as mobile company, but why is Samsung into healthcare? Samsung has got a great big hospital in Korea, in South Korea and Seoul, and now they want to literally, and they have created beautiful systems for that hospital there. Now they want to import pretty much all of that into the US. They're trying to buy some big hospital systems in the US and trying to build, port their systems as well as enable their systems better for US regulations as well as laws, as well as how the interactions happen with all the stakeholders in the US economy. Everybody literally wants to have a piece of the pie, and that's interesting because then the market opportunity for all of us here actually becomes even that much more bigger, because it's not just the healthcare companies or the pharma companies that we had to go after, but there are other companies as well looking at healthcare as a big area of opportunity. I wrote Xerox and Dell as well. Xerox, we know, is a verb literally, where we speak of it for photocopying. But Xerox bought ACS, which is a big healthcare player literally in the US state government and the MMIS area. So if you look at it, everybody, as I say, again, Dell bought Perot because they wanted to be part of the Healthcare Act, literally, again, in the same space, especially in the provider world. The traditional boundaries are blurring. Of course, these were also traditional boundaries being blurred, but there are more traditional boundaries being blurred. The insurers are in health. There was, there was some point of time when insurance companies had all kinds of, policies that they would write on life, on PNC, on health. And then they started becoming specialized, and then they kept only certain areas. And now they want to get back to health because they realize health is a big component of what they would like to do overall. The retailers are in health, and that's a very exciting trend that you see in the US, literally. And that's something that is to do, obviously, with the cost of care. The US system, I think, the US healthcare system, I mean, if I might say so, for being literally questioned heavily on this, is a very over-engineered healthcare system, I would call. A lot of complexities generated over the years. I don't know if anybody tried to simplify it over time, but it's getting even more complex as we speak. No complaints, because that's a lot of opportunity for us, literally in the IT industry, because we need to cater to those complexities and the exceptions and the kind of rules, the new rules that get implemented day to day. But if you see that, that has increased the cost of care despite the efforts that have gone towards this. And any single, emergency, I mean, even a flu shot requirement becomes an emergency in the US because you're not able to afford going to your primary physician, and you end up going to an emergency room, which costs you so much more than going for an office visit for a normal ailment. So to try and avoid that, you see retailers like Walmart, like CVS, like Walgreens, all of them are trying to see how to take care of such patients through much simplified care. You really don't need specialist doctors to figure out if somebody's got a cold and needs some cold medication, or has got a headache which needs initial primary verifications, and for which I think the US government has also allowed nurse practitioners to be able to prescribe simple medication for such ailments, and those kind of treatments are now being brought down to the retail stores where there's an opportunity to get patients to be seen, not big need for appointments, not big queues to wait, and it's not very difficult to get your self-treated or your child treated through these points of care. So it's really blurring boundaries that we see there. And there are global forces at work as well. I mean, it's an increasingly flat world. It is not just flat from an outsourcing perspective or where services bought and delivered perspective, but you also see it from a medical tourism area. It's a big opportunity. Medical tourism in India is, of course, a big market literally for that. We also have in other countries where there are similar lifestyles to the Western economies that have become medical tourism hotspots. And for us, obviously, all these are opportunities in an IT perspective to make sure that we can enable those interactions that we see. So what are the IT drivers that we see across the various stakeholders? Let me take one by one. Provider world, you have multiple areas, but just 4 or 5 of them that I thought I'll point out. There's increased regulatory focus. There's obviously a lot of requirements in terms of the usage of EMRs and EHRs that are literally being mandated. There's obviously the smaller hospitals that really need to start from having their health information systems, the HI systems implemented, whether it's product or bespoke that they decide how they will go with. They really need to make sure that they start complying to those needs. US brought in some rules for their hospitals so that they can, what they call as meaningful use is something that they need to implement for their hospitals and for their doctors. You also have the need for quality reporting, where the reporting has doctors would like to be able to have access to data about their patients as well, and the governments need a lot of reporting to be done about the about the patterns of disease that they see, so that they can actually take immediate action in controlling certain areas of obvious epidemic spreads. There's a lot of focus on performance and cost. Pay for performance is an area that providers have to be worried about, as well as be active or literally aware about, so that they can make sure that they are able to leverage the opportunities that that throws up literally, because if they're very good doctors, they really can get more patients and be able to continue to come and deliver better outcomes to their patients as well. From a convergence standpoint, if you see, there is a lot more. I spoke about literally the convergence of banks into health, the insurers into health, or the retail into health. I think all of these need IT enablement literally, because it just does not mean an access given at the point of care, but literally it has to get back into the insurer systems for reporting, for claim settlement, for for reporting on the stats of the diseases itself that they might have been treated upon. So overall, you would have multiple delivery models and the convergence to be taken care as well. And patient empowerment, I think that's one of the single largest drivers really driving technology today. Patient empowerment is something that as I wouldn't know about doctors whether they like it, but it is something that they have to live with. There are more and more of our brethren literally who, all of us I think, have access to information at our fingertips literally through the world of mobiles and of course iPads these days, or the tablets. And whether we are the patient or whether we are the caregiver of the patient, we have immense access to knowledge. And the moment the doctor says a word, we go back and Google and Wiki and find out what that means, and want to be the half-baked doctors that we are and want to have a good debate or a discussion with our doctors. There's some things I realize that doctors don't like it, because obviously it's half-baked knowledge, but it is something that we feel good about because we think we understand a little bit more about the ailment of our loved one, and figure out what is best for them to be treated so that they have less suffering and less pain along the way. But that's something that the whole world of mobility, the whole world of the technology that you see, and the whole world of knowledge systems that have been created, whether it's the WebMDs of the world or pretty much so many sites that you can just Google and get information about any disease or any condition or any symptom literally, helps us to get better knowledge and hence better access, and hence also figure out which are the right doctors we have to go to get those things treated, so that we have the best care available for ourselves. Indian hospital or the healthcare industry, but it's fast catching up in the Western economies because obviously they have the money to spend on these areas. But literally, I think cloud may be something that we might see as an adoption much bigger in these smaller economies, because of the lower investments that they have to initially make and a quicker ROI that they can get on those big investments that they would have otherwise made. So from a payer world, multiple, again, multiple considerations that the payers would have. Countries like India, we would have new systems that have to be created. I was listening to one insurance payer recently, and they were saying that while the cost per transaction or the claim, the dollar rupee value per claim in India might not be that high as compared to the Western worlds, the number of transactions or the transaction volume that they see is probably the highest that any country would get to give them, obviously because of the demographics of this country and despite the coverage that is so low in the private health insurance market. So you would have the need for most of these claim systems to be integrated so that they can really make sure that the right claim is paid, because there's also the risk of fraud, which is something that is very common in this industry as well as in all industries, where people try to take advantage of the system in trying to make money. So as long as in the private health insurance market, when cashless exercise in a hospital was a common thing, a couple of years ago maybe you would see, it was a great boon, people like us who really wanted to leverage the system because we didn't need to be worried about how we would go and pay when we were covered through insurance. But it was also a great boon for fraudsters, because they could actually get to create records of their relatives or whomever in hospitals and try to claim money through the cashless mode. And of course this is not possible without collusion with the hospitals or with the doctors or whoever. But that's something that again needs a lot of tools to make sure that you can figure out what kind of fraud is happening and how that can be trapped. And again, IT is a great enabler in finding out many of these aberrant billing patterns, as you would call them, in finding out and stopping those fraudulent claims from going through the system, and in fact increasing the cost of healthcare as these don't need to be actually in the system. Lot of cost shifting is happening literally. India is probably still very nascent from that perspective, but if you see the Western markets, we have woken up literally to the fact that the moment you say it's 100% covered, everybody wants the best care, the best hospital, the best treatment, the most expensive diagnostic to be run, all those kinds of things. But the moment you say that, why don't you be a participant in that decision, literally to see what are the things that have to be done by paying some amount of that money, either as a deductible or a copay or upfront or whatever, as different benefit designs have been created. The cost shifting has woken up the members literally, and they want to know what more they need to understand about their own treatment at the point of care. So liability estimators on the cost itself are some things that we are developing for these worlds literally. And I'm sure at a point of time it will come to India as well, where we also we would have the same wake up call to figure out that we need to allow these decisions to be made by the members themselves rather than being imposed just by the facilities. It is very normal to go to a hospital in India and be told, to be asked rather, saying, are you covered by insurance? And the moment you say yes, so you get a different higher slab rate to be paid. Whereas just the reverse in the Western world. Because insurance companies bargain and have a big pool of members for whom they bargain rates, the moment you are an insurance member, you actually pay less compared to an individual member. Here in India, it's just the opposite. So that's something that needs to be curbed as well, because that's something again is a collusive mentality in trying to claim from a system, assuming that the insurance company gets its money from the trees or whatever. It's actually the members or somebody who's paying for it, who's actually helping the system literally, but getting defrauded in a different way. So there are multiple tools that have been created, whether it is from a payer perspective, finding out the fraud and abuse, helping them do enrollments, finding out, making sure that today or post the point of care, but can they also be in a preventive delivery world as well? They have to make sure that is there a way they can also get plugged into these whole disease management activities that Dr. Shripati Rao spoke about, whether it's on diabetes care, chronic disease management, or whether it is in wellness management, of keeping the well actually is a big task for the payers, because those are the guys who really pay premiums but don't need to be reimbursed on claims if they remain well. So making sure that, and for that you really need to make sure that they are onto good regimens of fitness, on training, on diets, on nutrition. And all that can be made possible through the use of technology by, reminding them, making sure that they are on good adherence to these regimens that are created for them. So the whole population management that you see in these areas, I think, has become important for the payers itself. And from a life sciences perspective, I think I can skip this. Dr. Ratnakar, I think, spoke quite heavily on the areas of the drivers that are there, though he didn't allude to IT, and I was thankful for that, because I think that's the only population he left out from all the list of names that, or the opportunities that the pharma companies have for taking graduates like you. So you have, even in the life sciences companies, lot of, the drivers is obviously the whole the off-patent problem that they're having, whether the drying patent pipeline or a proper dried patent pipeline, we can call it, and the whole genericization that you're seeing there. How soon can we get, the data integrated between the clinical trials all the way up to the, the hospitalization data that, the hospitals are willing to give, the whole role of genomics, a lot of drivers that even the life sciences industry has, which are requiring the whole need of IT to enable their interactions. So the whole evolution, I would say, is as I would like to plot on the healthcare industry's IT evolution versus how the technology evolution has happened. Right from the the word fee for service is a common word that you hear in what we actually see today in the Indian context. Pretty much, you go to a hospital, you get treated, there's a service that's offered, and that there's a fee for it. That's the model that started. That was how it was started even in the US or the Western economies. But today, there are much more developed models that you see beyond the fee-for-service model, called the managed care models, the HMO models, different models where cost of care is actually, they try to bring it down, as well as increase the health and wellness of the populations that it actually caters to. And they have pretty much, kept track with the technology world, going from literally, clinical information systems, the financial system literally, to clinical systems, and now, of course, to EHRs and EMRs, and we are seeing integrated delivery networks being able to leverage off of each other, and treat each other well in a way that they can use all the technologies that are there on these evolution that you see. Cloud, SOA, mobility, internet, I think these are some things that are the in things of the day. It is very common that people like us, especially the younger population, whom we call the millennials, are the ones who are so used to the technology that when they get back to a corporate environment, whether it's an IT company or whether it is a hospital setting, they go back and see some of the green screens. They really get disappointed, what we call the Sunday night experience versus the Monday morning experience. You have great gadgets at home. You look at your mobiles and the iPads, and have learn a lot through those devices. But then when you come back on a Monday morning and look at an SAP screen or a Oracle screen, Fusion screen, you realize how backward most of these systems are, and how soon they need to really catch up to the reality of the world. It was very easy for us like IT